Hello everybody, welcome to session 4B. This is the last session of the day and it's a session on communities and mutual aid. I'm Véronique Jochum from NCVO and we've got some great speakers this afternoon. We've had two sessions on communities and mutual aid. The first session was looking at some conceptual insights, and today we're going to be looking at insights from the Frontline, and I'm sure the two sessions will work really well together, so I hope you were able to attend the first session. And I'm sure there'll be some overlap and some of the same comments that will be made as well. One of the things that have come out quite a lot is the issue around definitions of mutual aid and volunteering, and we've had some really good discussions. The way the session is going to run is that each presenter will talk for about 10 minutes and we'll have the discussion at the end, so we'll have about half an hour for discussion. Questions can be asked using the function, the Q&A function at the bottom of your screen. You can also use the chat function to put comments or to share resources. And at the end of the presentations, my colleague Chris Damm will be facilitating and looking at the questions and seeing what comes up. So I encourage you to use the Q&A function throughout, and we'll have a look at the end. So the first presenter is Amanda Smethurst, who's an independent researcher, and she's going to be looking at the role of creativity during COVID-19. Amanda, over to you.
Thank you. I'm just sharing the screen. Thanks, Veronique. Thank you for asking us to be here as well. So just to say, I'm Amanda Smethurst. I'm one of 3 researchers contracted to work collectively to evaluate the Creative Civic Change programme with local communities. Creative Civic Change is a programme co-funded by local trust, along with Esme Fairbairn Foundation, Calouste Gulbenkian and the National Lottery Community Fund. And it involves 15 projects around England who are all using arts and creativity to create meaningful social change in their areas, and that's the fundamental premise behind it. The programme funders have focused on ensuring that the projects are locally led, and as such all are working very, very differently as they respond to local needs. The projects include activities such as uncovering and sharing the stories and histories of an area, revitalising neglected public spaces, workshops and making sessions culminating in festivals, carnivals, lantern parades. And community leadership is really central to Creative Civic Change, and all of the projects are led by local residents in a variety of different ways. And what I'm doing today is just looking at the role of these community-driven creative projects during the pandemic, at how the projects have addressed some of the challenges of COVID-19 and the impact on resident-led decision-making. So, just to move the slides on, it's not moving. Here we go. So just to explain a little bit about our approach and methodology. Our research ethics in terms of the evaluation process tie in very strongly with the overall CCC ethos, really centering creativity and co-creation at the heart of what we're doing as evaluators. So firstly, when we started with the projects about a year ago, co-creation was core to us. So we put communities in the lead through a mapping outcomes workshop, facilitating a series of creative kind of processes and workshops to help the CCC areas decide the outcomes that are important and meaningful to their communities. And while there are specific nuances to some, for instance, in one case, they detailed the smell of the area as being something that they wanted to evaluate. There's also similarities across some of the areas as well around pride, community pride, sense of improvement in local environment and the sense of connection across communities as well. From that, we co-created an evaluation toolkit, which drew on ideas in the workshop, as well as our own practice as evaluators. And this toolkit was provided to create a broader support package for the places to evaluate their projects as they go through. We've used creative evaluation methods essentially to facilitate better conversations. We believe quite strongly that creative data collection can be a way of engaging people in a really useful format. And we produced a COVID-19 edition of the toolkit specifically as well. So the research draws on 3 sources of data: the evaluation reports that are given to funders, reflective learning sessions that we're holding monthly, and semi-structured interviews, which we're conducting with everybody as well. The interview strand was added because we wanted to understand more depth around how CC was responding and unpacking throughout COVID, really, essentially. And some of our main findings, so what's happened and what's kind of changed. Delivery mechanisms. It's been a really obvious change in how the projects are being kind of delivered. CCC projects have been very resident-led and incredibly face-to-face, as you can imagine. And since March, that's had to change. So a variety of ways that's changed. Once lockdown was in place, some projects have shifted entirely online, through to some retaining a very kind of local and niche physical output. We've seen some blended, so Don't Get Any Ideas in Corby are one of many places that have regularly been sending out activity packs alongside use of social media to create connection, to check in with people, and using platforms such as WhatsApp and Facebook to retain connections and support families. Urban by Nature and Walthamstow have commissioned a doorstep photography project, as well as sending out statues for people to paint, which will then create a collective exhibition. And some have gone online only, such as St Leonard's, who've moved their choirs and drama groups online. Online activities have reached more and different people than previously engaged, but some of the content has a longevity, but we're still really conscious that they're not reaching everybody, because obviously not everybody has access to technology, so some are still excluded. And face-to-face and word-of-mouth in the past have played such a significant role that that's shifted now in terms of how communities are reached and engaging in the projects. But overall, we've been really impressed at the flexibility of projects and how responsive they've been. A really big thing is for all of the areas, not surprisingly, has been around mental health and isolation. And in each area, this was a significant concern within projects. And they've worked really hard to find ways to try and reduce isolation and sustain connection in community. For some, this has seen them bordering on the edge of social work. So where they were initially dropping off creative packs, that might have taken 20 minutes at the start, but now it's taking sort of 3 hours each time they go round, because people are wanting to talk and have a sense of connection, showing their creative work, but also talking really honestly about how they are and the issues they're facing. And we've also seen creative activities that have been developed that encourage people to come out again. There was a real sense of nervousness about coming out after lockdown. So for instance, a project devised a creative pack around doing rubbing, so people were encouraged to come out and actively be in their streets, in their space, rubbing rain covers and trees, for example. We've also seen impact on decision making. So the CCC projects were all led by local residents, as I've said, and we've seen a shift in their governance and their ability to make decisions since lockdown. Most projects have moved to Zoom for key meetings, partly enabled by local trusts who funded Zoom accounts for the projects. For some of them, this has meant more regular contact, and effective decision making is getting together online has actually been easier than in person, so they've seen each other more. It's also led to them finding new ways of having honest and challenging conversations sometimes, especially where two people might not agree. So we've seen one project in particular talk about how they have come to a position where they agree that consensus isn't always necessary, and what they're really interested in is creating space for everyone to have a voice in the room, and reflecting that this is a much more honest and open approach than pre-COVID, where it was about consensus and people just saying yes. So actually the level of challenge and governance is higher. We've also seen them meeting in front gardens when the sun's been shining as it is today. And then with partners and partnerships and relationships, we're lucky that the projects were up and running before COVID hit, so many of them had really strong partnerships and relationships in place already. And these have been really crucial. So for instance, with residents, online activities are still coming from someone you know, so therefore being visible and physically alongside people in the local neighbourhood throughout the crisis has been possible. So there's that sense of trust that's been really critical. artists again are able to pivot and change activities as they already know and get the communities that they're working in. And organisations have been linking in with the wider COVID relief too. And we've seen several of the CCCs actually partner with big locals and other organisations to do food bag schemes and similar things. And in terms of implications, with delivery, we're starting to see small shifts now in how the projects are delivered and steps towards face-to-face delivery happening. For instance, in Newington, there's doorstep puppet shows being developed, which are going down really, really well. So they're very small scale, but really well received. Many of the projects now, though, are seeing lockdown restrictions being applied again. When you hear around the country, the areas being locked down, many of them are CCC areas. So having the confidence that they have now in online delivery also means that projects are looking at more mixed hybrid models moving forward, so things that can flex as the inevitable restrictions take place. Having said all of that, ambition still rides really high, and we see some like Urban by Nature, who have a significant project within London Design Festival this month, with huge public art projects of scale, working with local colleges and so on and so forth, alongside gentle community interventions. So that ambition still sits there. There's still questions around community reach as well, about how far, recognising limitations of digital work. This was a challenge before lockdown about really reaching within communities. So some projects have produced newspapers, have done all sorts of things to try and reach beyond and broker that digital divide. And key to the successes of the projects moving forward will be sustaining that and really making sure that that reach happens. And it's harder now with face-to-face and incidental contact not possible. Resident-led decision-making is a fundamental part of CCC. It's one thing to engage in activity, we know, but it's another to enable people to truly lead or make decisions. And pre-lockdown, several projects were already keen to increase and broaden the membership of the working groups through very consultative approaches. This is more challenging now, and there's a risk that taking the easy way will be more prominent. Zoom meetings, I think, will stay well received, with a lot of growth for online forums. And in terms of other implications, looking back at the programme overall, our evaluation methods, as I said, were founded on creativity, along with the kind of fundamental principles of CCC. This is still possible to do, though it's required a lot more imagination from us and also from the places to think about how they can really embed different and robust techniques in what they're doing. So we've been working with them, as I said, to create a new toolkit to support them and thinking about how that can happen with digital work and others as well. And finally, funders and policy making. A key element of CCC has been the enthusiasm of the funders to also reflect on the practice and policy making around supporting local communities. And we've seen it's been refreshing to work on a project where that's really embedded, actually. We've seen the funders be really responsive to the needs of local projects and pragmatic about funding deadlines, the scope of the project, outputs, which has all been very welcome. And we're planning further conversations with the funders and communities to join up so that people can really share experiences about what that funding process has been like, with a view to it affecting and changing, hopefully, policy making and funding guidelines looking to the future. So that was just a really quick fly through, and I'm really interested to sort of hear any questions that anyone has based on this and all the other presentations. But thank you for listening.
Fantastic. Thank you, Amanda. That was a very rich presentation. You were only given 10 minutes and you managed to put a lot in there. I thought your implications section was very positive, especially regarding funders willing to work slightly differently, which I think is you know, a good thing, but maybe we can talk about that later.
Yeah.
Chris, I don't know if there are any questions of clarification for Amanda, or whether we should keep the questions for later when we come back after the presentations.
No, we've got a couple of questions, but I think we can hold them till the end when we have our sort of general session.
Brilliant. Okay, well, let's move on to our second speaker. So our second speaker is Patrick Harman from the Hayden-Harman Foundation from North Carolina, which is amazing to have somebody from the States. Welcome, and we look forward to your presentation.
All right, thank you so much. Yeah, so hello from America. I'm Patrick Harman, the Executive Director of the Hayden-Harman Foundation. We're a local grant maker that works in a couple of communities in the central part of North Carolina. Just to give you guys a sense of where High Point is, we're in the mid-Atlantic, halfway between Washington, D.C. and Atlanta. And some of the major industries in town are furniture and textiles. All that stuff used to be made here, but now it's mostly trade shows. A couple of times a year, our town blows up to about twice its current size. Just a bit of demographics about High Point, about 112,000 folks here in town, about 50% white, a third African American. There's quite a bit of poverty in High Point. 20% of the population lives in poverty. With NAFTA, things have changed since the 90s here in town. As most of you guys know, there really wasn't a sort of coordinated national response, shall we say, to the COVID pandemic. And so it's really been left up to the states, each governor of each state to figure out how to address the COVID pandemic. So I just wanted to give you guys a timeline of how that occurred in North Carolina. So the governor issued a state of emergency, which really was the foundation for all the other orders that he gave on March 10th. And then the schools are closed on March 14th. And then we had our serious lockdown, not as serious as you guys, but our major lockdown was in March for a while, and it's kind of loosened up, just like you guys, over the past couple of months. But these items in red are the ones I'm going to talk about as far as community reactions to COVID-19. And so the weekly calls was called Super Tuesday, and then a website we launched back in April. So those are the things I'll be talking about in a little more detail. So there's some other things that I really don't have time to talk about in detail, but some other things that happened here in town. Most United Ways here in America started a COVID fund and raised money to redistribute to other nonprofits. And the one here in High Point started right from the get-go, right at March 17th, right after the schools closed. And they give out weekly grants for about 6 weeks to other nonprofits who are working with the community, addressing some of these issues. And there's the Greater High Point Food Alliance, which is a collaboration of organizations to address food insecurity and food access here in High Point. And that they got a lot of funds, and they redistributed it to pantries for sanitation type projects, and then connected people with local food resources. The schools were doing in the lunch meals out in the community. And so there's a lot of communication about that. And a lot of the volunteers for the food pantries are older folks, and they didn't want to volunteer during the pandemic. And so the Food Alliance recruited some volunteers. And then Resilience High Point, which is a more recent collaboration of organizations trying to address adverse childhood experiences and try to build strong communities and fill in the gaps, organize some virtual events to talk about COVID impacts, and then also facilitate a collaboration among youth serving organizations for some virtual content for summer programming. So that was going on as well during this time. So I want to talk about DUP Super Tuesdays. DUP is a youth serving program, works with about 50 low-income students and about 20 some families, and this is something the executive director organized right from the get-go. So I interviewed her recently about why she decided to come up with the Super Tuesday idea. And so they have these 4 E's that they try to target with their program: eating, educational, emotional, enrichment needs. And she knew that wasn't going to happen with the kids at home. School is still online, starting right now. And then of course there's the digital divide that's already been mentioned. So we actually provided funding for some computers for the families. And so basically every Tuesday, families are given some different food varieties of foods, some educational activities, and enrichment activities as well. So that happens every Tuesday. There's a group of the folks who volunteer and deliver these boxes to the families. We also do a weekly update on COVID-19 and what's happening, available resources, and that was a precursor to the website. That's something I put together. And they do a lot of activities through Zoom, as would be expected. There's a teacher on staff that helps with some of the tutoring. And so I asked her what some of the perceived impacts she thought she was having, or the organization was having. That's addressing food insecurity. It's really important for her to maintain relationships with the families, find out what's going on, to be able to meet their needs. And then she was really pleased with the fact they were able to support academic and emotional needs for their families. And so we also collaborated to do a parent survey, really wanted to find out what was going on, the impacts of COVID-19, the pandemic, and the shutdown on families and how they were coping. So that's been administered 3 times. It was April, May, and then a couple weeks ago in August. And that was shared with the other stakeholders in town as well, and was used in some grant applications. And she found the survey results really important because they were able to tailor support to what the families needed. There were some idiosyncratic needs that they were able to attend to. And so they created programs to address anxiety levels. They did yoga over Zoom, for example, and then the tutoring and enrichment activities I already mentioned. They also have a therapist as part of the programming, and so he's been able to use Zoom to do the therapy with the children to keep that going. So just a few results from the parent survey. Anxiety is still high. The food insecurity has been addressed with the families, and they're still concerned about helping their children with assignments. School started back in August, so that's a continual difficulty. So the second thing that's happened locally is these weekly calls that were engineered by a foundation executive director. This is the Health Foundation, and that's her email from March 13th about getting together and talking. So when I interviewed her, it was wanting to find out what others were doing and expand efforts, hopefully some collaboration. And so there are 15 people on this distribution list, and typically 7 or 8 in the early days would come on every week and give updates. And there's the list of folks who participated. More recently, it's kind of drifted down, which I'll talk about at the end. Generally 3 or 4 now. And so I surveyed the folks who were part of these calls, and they all felt it was really helpful, particularly to share and learn what was going on, particularly in the early days. It really impacted the work as far as knowing what's going on. It's particularly important for funders. That's already been mentioned about how to target their funding and who's doing what with funding. So in efforts not to duplicate efforts. That was a big part of the findings for the participants in these weekly calls. So one of the things that came out of this weekly calls was a question about how do folks find out about what's going on with COVID and testing and resources. It sort of dawned on me it'd be really helpful to have a website to communicate this out to folks. And so we did a campaign, the yard signs, kind of like a political campaign, and got this website up and going in mid-April. And this is an email from me out to folks. I was trying to get good collaboration going on, which we did. Because it's really important, I think, to show the community that we're all sort of bound together in addressing COVID-19 pandemic. So here's some screenshots of the resources webpage. So there's information about COVID testing and how to keep safe from COVID and the like, and information about the governor's orders and that sort of thing, what was open, what was closed. Variety of local resources, where to find food, the summer meal sites. There were executive orders on evictions and utilities and that sort of thing. So all that was for the local resources, and then state level and then federal level as well. There was the stimulus from the federal government and the pandemic unemployment insurance offerings that were over the summer. So that was all kind of updated on this page 3 or 4 times a week.
Patrick, you've got about 2 minutes left.
Okay, all right, I'm almost done. Okay, just some stats. First couple of weeks, there were about 1,000 users. This is before we used Google Analytics. But I've been able to respond to other folks as well. And then the Google Analytics, I mean, as you can see, or to be expected, I mean, the use on the website was heaviest from mid-April to the end of May, and it's drifted down a bit from about 20 folks a day to about 9. So just thinking about the implications, I really think existing relationships were fundamental in all this, because a lot of these things were activated quite quickly, and it helps being a small town, we kind of know each other. And so we could hit the ground running with these different ideas. I thought communication was key to get a lot of this done. There's a lot of overlap between the weekly calls, the Food Alliance, and the Resilience High Point, so people could share information out to other folks. And so you really were sort of communicating information out to hundreds of local organizations about what was going on. Not a whole lot of collaboration other than funding, so that was kind of a disappointment with the director who started the weekly calls. hoping to be more collaboration between sectors in particular. I think within the nonprofit sector, there was good collaboration. And I think sort of this, as people got used to COVID, this sort of interest in sort of banding together to do new initiatives and programming to address COVID-19 just kind of drifted away. So I'm not sure exactly how to maintain interest, but I'd be keen to find out maybe some other insights from the other panelists today. Well, that's my presentation, and thanks everybody for listening.
Thank you, Patrick. Really good to have an example from across the Atlantic and to see the diversity of community responses and the similarities with what happened in the UK. We'll move straight on to the next presentation, and my paper has just dropped on the floor, so I will pick it up. Apologies. So the next presentation is about community responses to COVID, and it's a presentation from Wendy Sugarman, Richard Usher and Rob Macmillan, and I believe Rob is going to start the presentation.
I am. I hope you can hear me. Can you just give us a nod, Véronique, if you can?
We can hear you.
Yeah,
it's a little bit faint, but we can hear you.
Okay, well, I'll try and speak up then in that case. Well, hello everyone. Let's just talk very quickly then about community responses to COVID-19. I'll be presenting this alongside with my colleagues Wendy Sugarman and Richard Usher. We're from a large research team undertaking a kind of a long-term project about community responses. We're 5 or 6 months into a 15-month project. So Richard, do you want to move on to the next one, please? Next slide. So we know about the massive kind of community mobilisation that's taken place during COVID-19. The research project we're undertaking aims to provide real-time insight into community responses to crisis. And our core question is, how do communities react to, how do they cope with, and how do they recover from the COVID-19 pandemic? We're studying 26 different areas, neighbourhoods, in England, and it's partly linked to wider community development programmes, in particular the big local programme, which is run by Local Trust. It's a resident-led community development programme. The research team is a cast of thousands. There's 15 of us. It's led by colleagues at the Third Sector Research Centre, particularly Angus McCabe, but also our colleague Mandy Wilson as well. And it's funded, we're thankful for this, by Local Trust, who run the big local programme. And it's a 15-month programme, as I say. So we're trying to provide real-time insight. We provide monthly briefings. The last one just recently out is from Angela Ellis Paine on volunteering. And also we've got a phase 1 interim report, which is in progress as well. There's a link to all of the materials that have been coming out of the research so far. Richard, again, can you, if that's okay? So one of the ways in which responses to the pandemic have been framed is in terms of resilience. So it's a very favourable, fashionable kind of word. It gets used a lot. We don't like it that much in our research team. It kind of implies that you've got to kind of cope with things, adjust to things. Can you bounce back to adverse situations? There's no great sense of agency or creativity in there. There's no great sense of inequalities in power and resource there. So we've preferred to go down a framework suggested by a couple of human geographers. The link is at the bottom there, the citation, which is called resourcefulness. And there are 4 elements to resourcefulness. One is about the kind of resources, human and financial, that you can bring to bear, about the skills and technical knowledge that you can bring to bear and convene, local knowledge that you might be able to bring, but also some kind of recognition about communities' rights to mobilise, attract and manage new resources. So this is, we think this is a preferable framework to try and use, and so we're going to try and illustrate that through some of the material that we've been generating through our research. So it's on that basis I'll hand over to my colleague Wendy Sugarman. Thanks, Wendy.
Thanks, Rob. Can we have the next slide, please, Richard? Brilliant. So I'm going to just take us through the 4 areas of resourcefulness. So resources is the first one, and that kind of splits into human, physical and financial resources. And I think the quote just really summarises it actually. So a key factor was the mobilising of people, including organising online meetings for resident-led partnerships in big local areas to help understand and respond to needs. And in some areas, staff were redeployed to food food banks and other projects. The people resources led to a whole range of projects. So just some of these, there's a whole lot more, are food projects, signposting, information given out, craft packs, and phone calls to people that are isolated. And a key part of the people response was an increase in volunteering. So we had a couple of areas that had really big sign-ups for volunteering, 60 people, 40 people, etc. So whilst that was great in terms of capacity and willingness, it was also challenging, and it reflects the national picture a little bit in that not all of those people were mobilised and actually ended up volunteering. And there was also some conflicts between how formal the volunteering should be, so formal and informality. Another aspect of the human response was around the partnerships and the relationships, and certainly for big local areas that have established relationships in the area, it was much easier to pick up and work in a kind of partnership way and to set up projects for the local area. In terms of the physical, the main thing really was the flexible use of community assets. So where there were community hubs or community centres that could no longer be open in their kind of for their main purpose, they were reassigned as food distribution centres. Sometimes it built on a food project the community were already running, sometimes it was a new food project. And they were also used for things like making craft packs, making phone calls to people that were isolated, other things. And then finally, in terms of funding resources, big local areas use their community grant funding to support other community organisations. They also funded other local responses where they felt that was beneficial. And they also, in some cases, funded individuals, for example, to help people get online or to make PPE. Those are a couple of examples. Can we have the next slide, Richard? The next area is skill set, so using skills and technical knowledge. And one of the things that was really noticeable was the speed of moving online. So getting meetings in place, but also actually recreating some of the regular activities that they've been running as communities online. So things like knit and natter groups, coffee mornings, yoga classes. And I think some of the learning that's come out of this interim stage is that it was much easier for communities to move existing groups online rather than trying to set up new groups. Probably not surprising, but it was, you know, a finding. There's also been a step up in some areas in responding to financial and emotional needs and setting up online kind of engagement around and support projects around that. Another thing on the technical side was social media around community support, which was really scaled up. So there was lots of use of Facebook, Twitter, WhatsApp, and across the areas involved in the research, our teams archived, I think, over 1,200 posts from social media and been monitoring that and looking at the trends within that. So there's been a real move to support communities to get online. Some of the areas in the study gave out tablets, others paid for Wi-Fi access. You know, digital inclusion was seen by communities as a real challenge, and obviously, you know, in this kind of COVID situation, there was a strong need to support people to digitally connect. Local Trust provided big local areas with Zoom subscriptions and technical support, so there was a real move to support people. So moving on to the third area, which is around knowledge, so it's around local and cultural knowledge. The communities had a strong knowledge of community needs. So, for example, big local areas have been established for 8 years. You know, they really, that helped them to hit the ground running, to set up respond to need quickly. The other thing within that is that communities also have a key role in supporting communities to access local authority and other statutory providers. And a number of the areas that we spoke to felt that they'd filled the gaps where statutory agencies had been slow to respond. So they'd picked up support for people that had just fallen between the gaps. So there was quite a lot of, you know, there was kind of mixed feelings really about the levels of support from statutory services and the role the community had to play. And there was also a whole range of informal support, things like community connectors. And then finally moving on to recognition, which is the fourth area of our quadrant of resourcefulness. So whilst there's been some increased involvement in broadening kind of the group or the active residents involved, there's a kind of hope that those people will stay beyond this period. But the kind of early indication is that after an initial influx in some areas, they are struggling with capacity and also the longevity of the crisis. You know, people mobilise themselves in March and are kind of, you know, sustaining and keeping going at that kind of level, you know, is something, yeah, is a challenge. For some of the areas, there's been a new self-confidence supported by the status that others have given them. They kind of realise actually they are appreciated, they do have status, they do have position, and that's being recognised. So, for example, in one of the communities that we studied, it was recognised that that big local community was providing the broader voluntary sector infrastructure. And I guess kind of conversely to that as well, while it's been mostly positive, there has been some areas where there's competition between groups for the kind of kudos of representing the community. So that kind of takes you through the 4 areas. And I'm going to hand over to Richard, who will talk about the implications.
Richard, I'm afraid you've only got about a minute or 2 minutes at the very most.
This will be very fleet of foot then. Onto policy and practice. Thank you, Rob and Wendy. Thinking about flexibility, we heard there the responses have varied depending on local needs, the role of larger agencies and statutory bodies, and we've heard local community organisations responding rapidly and flexibly. So the question that throws up to us is how can that flexibility be built on across those 26 communities and more widely? Does this have longer term implications for new ways of working? And how do we continue to address that issue around digital access? Thinking about community connections and mobilisation, the pandemic has highlighted pre-existing relationships rather than fundamentally changing them. This is what we've learned so far. Where links and connections within or between organisations existed, those have been strengthened, but where there are tensions and stresses, those have been exacerbated. So in that context, and in the context of ongoing stress and ongoing the take-up by communities, how do we support communities to avoid a feeling of exhaustion or burnout? How can communities be further supported to build on the mobilisation around their existing assets and those existing groups in communities? Also thinking about statutory expectations, one outcome has been an acknowledgement at that level of the interdependency of community organisation and public organisations. Thinking ahead, that may require more close partnership working and building on the trust and relationships that have been developed. And central to that will be anchoring that community voice, which has been all important in orientating these community responses. We're also aware that we need to understand better the internal power dynamics within communities to ensure inclusion and address inequalities. So some communities were readier than others to respond and able to make more effective use of their resources. We've heard about the types of example Wendy mentioned there. I would like to just take you very briefly looking ahead at where this research is headed, thinking about the specificities of community-led decision-making, different degrees in which community-led groups can actually lead and take on the next phase of recovery, and the extent to which the funding, which is part of the local trust programme, has enabled those changes to happen. And I wanted to leave you with the quadrant that Rob introduced earlier around resourcefulness, the underpinning that we see to this research. Thanks very much.
Thank you, Richard, Wendy and Rob. Sorry to have rushed you, but we do have 5 presentations altogether. I would encourage people to post things for our panelists, any questions using the Q&A function. Now for the 4th presentation, so this is looking at community responses in Birmingham and Solihull. And we've got Stephen Rose from the Active Wellbeing Alliance. Societies, apologies.
Technical moment, hang on, bear with me. Okay, can you hear me and can you see that, folks? Yeah.
Yes, we can, and we
Great.
can hear you too.
Well, okay, I shall make a start. Thank you. Hello, yes, I'm Steve Rose. I'm a director at the Active Wellbeing Society. So we talk a bit about what we've been doing, but I really want to emphasise and stress when I say we, there's a collective we here. There's over 85 plus organisations that have been a part of this community response. And we also then asked an organisation called the Leadership Centre to come in and look at a kind of question which was, the ways and principles we've been working leading up to before COVID, we felt were a real foundation for how the community as a whole in this network response was able to happen. And kind of in effect, objectively look at that and say, are we, living in a world of confirmation bias there, or is there some kind of element of truth to what we think within that? That was kind of the question we gave them. Okay. So that we did one before was based on a civic activation around a programme called Active Communities, which is based from a Sport England funded programme that we've been doing, which is basically on the premise that if we can get people civically active, we can get them towards physical activity and vice versa, a kind of endogeneity between that. And these are the kind of principal outcomes that we're looking to get within that. I mean, overall are kind of removing the barriers, promoting resilience and doing social knitting in that kind of context to provoke active citizenship. So that was the kind of basis of what we've been trying to do. The key bit within that, I suppose, are the ways of working rather than what we were doing so much as how we were doing it, which is working deliberately in a kind of whole system leadership way, kind of recognizing complexity and knowing that there isn't sort of a machine built thing that we know exactly what's going to do and how it's going to work. You have to sort of step into the space and let things emerge. The idea of distributive leadership and working with communities, not to them, and then deliberately working with, when we say unusual suspects, by that we mean not really typically groups or organisations or networks that already have the power, in systems, I suppose, and trying to build those forward and therefore co-creating. And I agree with the point made about resilient. I have used the word resilient, but here we're talking more about being able to see opportunity and seize it rather than just survive the knocks and bounce back from it. Then, of course, that happened, and we all know about that, right? So what the point was on the basis of that was what happened then. And I guess our view is on the back of the way we were working, there was an agility of responsiveness that we and our partners and the partners that we work with across the community were able to step into far quicker than the agencies and things that were there to do. We set up food distribution. Aston Villa Football Club had a football pitch full of sharing stuff that you could go and collect food, clothes and things like that. We had an online befriending service and so on. These are kind of things that we focused on. I'm going to run you quick through some of the numbers before I get to the crux of what, why we think that worked. The key point I want to focus on here is that of all the thousands and many thousands of requests that were coming to the Active Wellbeing Society, over 77% of them were coming from the highest 10% deprived households in the community. So these, we were really reaching and getting response from those who were most likely in need of it. And there's kind of stories behind that. We're really backing that up. We fed an awful lot of people. The Active Wellbeing Society has fed over 56,000, nearly 57,000 people with food parcels to families, cooked a whole host of meals, but also held, and again, thanks to ultimately Aston University, who helped us create basically a food distribution centre. These kind of things were all happening at ultra fast speed with many, many organisations involved, over 7,000 partner parcels going out as well. So a real huge scale there. The online, the telephone befriending service was kind of split into three tiers. People who came directly to it, those who we knew, through all the different community activities that were happening already and reaching out to them, and then also GP surgeries referring us to people who would have been on their books or on their social prescription notes and speaking out to them. Some real kind of challenging scenarios happening through that as well, and kind of real insight into the kind of the real hardship. Someone mentioned in the chat earlier the trauma. Well, there was definitely a lot of that in the community. We switched quite a few of our activities that happen in the community into an online space. We heard a little bit about that earlier, and kind of, I think a lot of people brought with it, but we feel that we found quite a new audience there that weren't there before. And actually there's a sort of desire to keep that kind of stuff going, and some of the stats around what we've been able to gather, and that suggests we've managed to reach out to an audience, which is interesting. We're also able to offer further support, things like that on the back of that. So there were key workers who ended up being loaned 82 bikes from our bike scheme that we have. And, that was really helpful in making use of the quieter roads, but also 400 people who came through the befriending service have ultimately been referred on to being able to get them benefits that they were due and get them income and stuff that they weren't otherwise getting. So they're kind of a much more holistic kind of needs-based approach, I suppose, and just treating people on the face value of the need that they presented with. Again, I want to stress this point. I'm not really here to talk about the nature of what was done. It's more kind of, did it happen? And what were the conditions that were created to make it happen? But a whole host of organisations across Birmingham, big place obviously, and Solihull, but a real community and community organisation effort across the piece. A huge volunteering effort. We worked with directly over 800 unique volunteers. Most of them, 7 out of 10, are largely happy for want to future contact and involvement. That will come to be seen, but a real major input and effort, which took an awful lot of organising. And there was a mention of conflict about how much you organise and how much you don't earlier, and there's definitely findings in respect of that. What I want to focus on is the kind of feedback that we got from the Leadership Centre, who conducted their research by going out and interviewing many of the organisations involved in the network across the piece, and with a view of looking at were the kind of working practices within that Active Communities programme kind of in part useful in terms of how the agility of the response and the speed, the scale of the response that was able to happen. So first soundings are on the return on relationship here. The sense that the COVID was the trigger and that we had the triangle, we kind of knew all each other, and we've heard before about how existing networks have been so important. So there was definitely a kind of, moving at the speed of trust, and because trust was there to a certain extent, that was able to be done. We as the Active Wellbeing Society sit in this weird hinterland between being a community organisation as a community benefit society, but also to a certain extent we represent and fund and speak to some of the major organisations in the city, like council and that kind of thing. So we were able to do a bit of brokering. We kind of referred to as the kind of backbone, while the smaller community organisations are like the nerve-ending networks out in the community. A kind of nesting of leadership within networks and being a credible organisation speaking truth to power was really important. A kind of track record of advocacy in all spaces too. I mean, the key point there is about how, as a network, we were able to be responsive because of the fact that there was an investment in that network already, which I think was important. The next point I want to make was how the network as a whole recognised that we were really leaning into and being brutally honest about the nature of the challenge, the kind of real trauma that was happening, the fact that, so this is one quote from somebody, poverty cuts you to the bone, then kills you, and we were kind of all on with that. There was a kind of removal of the cloak of invisibility of the challenge that was there in the city anyway, and how much it was exacerbated by this. But a massive operation in sincerity, and people were able to step into that and be clear about that. There wasn't a sort of a move from agencies and things to try to sort of smooth that over or ignore it. There was a trust in the human experience that was being told through the stories and the reality that was coming forward, and an ability to make decisions based on that, rather than applying some algorithm or something that says you qualify and you don't. It was kind of like taken on the trust of the human experience that was there, in that way, which was important. More kindness than trust, I suppose, is a way of putting it. And a kind of a move from being kind of right on as community organisations to and potentially sometimes aloof with that, but to actually get into the heart of the matter, which is making it happen. The kind of point about we all did somersaults, and of course somersaulting, you don't know where the floor is and which way is up and all that kind of stuff. And I think we kind of all recognised that, but we would describe ourselves as a network working in kind of bounded instability, is a good way of putting it, or perhaps in the edge of chaos. It's tempting to think you can plan this or control it, or there wasn't an overarching Gantt chart for our 85 organisations that said this is how we're going to do it. It was create the conditions and the space and the trust, and then let people go for it. So that was a real. I think that it was noticed within the research that there was a lightness with which power was held by those who had it, and I think that was an important way of kind of describing it. Communications was really important. There was a myriad, as you can imagine, of WhatsApp groups and things, but they were not abused. They were used in that kind of way, and I think it was really, really important to think about that. So really exchange of information, exchange of stories, and exchange of the kind of human experience. I want to conclude with some takeaways. It's been a sort of, feels like a lightning speed of that. And this is, in a sense, the way this work has gone, hasn't it? But some of the key things I wanted to focus on. The diagram on the right, you've probably seen before, I don't know, but I think it's important for us to recognise that we're on the left-hand side of that diagram where things are not, you know, kind of understood exactly, you know, so, but we feel more in the complex side of things. So you've got to act, you've got to make things happen, you've got to probe, sense and respond, but things will be emergent and go with it, you know, and ensure you've got feedback loops for creating this sort of space where people feel empowered to be able to act and work together rather than over plan it, you know, which is kind of more in the complicated side of things, yeah, which allowed, I think, the community sector and communities to have that kind of agility. The importance of the unifying cause, we heard that a little bit earlier from a speaker from over in the States, you know, kind of, is it waning a little bit now? You know, it's not everybody's problem anymore in that same way, and so it's waning a little bit. How do we find ways of maintaining the drive as that unifying nature wanes? A deliberate and overt intrinsic motivation. So much storytelling is about what others are doing and how well they're doing, or really telling the truth of the trauma that's out there in the community, as opposed to it being a sort of bun fight for how we're all doing really good stuff and fighting for money or something, which is quite often the case, you know, in a kind of community setting. So therefore that leaves me with the importance of the storytelling and the importance of humanity within this, and how the agencies in this space were able to act on that rather than necessarily some sort of SLA scenario, which is often the case. And then the final point I want to put in there is kind of the rise within this of a kind of alternative societal models. You know, the rise of the sharing economy, something here, many ultra-local networks sharing resources, sharing clothes, sharing, you know, things that they've got, citizens' assemblies. We've heard about online and how people have really embraced some of that. Not everybody, but really embraced citizens' assemblies in that kind of way. And perhaps a different way of looking at what the best in society can be, whether that's into wellbeing, economics, etc. There's lots of, for me, within this, examples of how that has worked and that we must not forget and we must lean into in a policy environment. So, wow, it's a whistle-stop tour of what's happened, but that was kind of the feedback from the Leadership Centre in terms of overall, those conditions probably did help allow us to respond in that kind of way, but there's much more to learn and lean into to be better at it. There you go. That's my presentation.
Thank you, Stephen. That was really fascinating. It's great that you've been able to stand back and reflect already on your experience. Lots of learning there. Thank you for sharing that. Okay, so last presentation, but not least. So this is about an evaluation of a neighbourhood-based project for older people during COVID. And we've got a number of presenters. I think Luke Price is going to start from the Centre for Ageing Better, followed by Chris Dayson. Thank you.
Hi, yeah, so I'm going to kick off the presentation with a bit of background information about what the evaluation is and where it came from, and then Chris is going to talk a bit more about the actual findings. So I work in the research team at the Centre for Ageing Better, and we're a charitable foundation that's part of the What Works network. And we were set up back in 2015 to look broadly at how we can ensure that everyone has a good later life. And the way that we do that is we fund lots of research that's aimed at understanding policy and practice, particularly across England. But we also have several local partnerships, one of which is with Leeds City Council and Leeds Older People's Forum, which we set up a few years ago. And the purpose behind these local partnerships, and this one specifically, was around enabling Leeds to adopt evidence-based practice, piloting innovative approaches, but also generating new evidence that can be shared locally, regionally, nationally, and internationally. So within this partnership, we funded lots of different pieces of work, but the one that Chris and I are talking about today is an evaluation of what's called the Leeds Neighbourhood Networks. And that evaluation is obviously led by Chris and the team at Sheffield Hallam University. So what are the Leeds Neighbourhood Networks? They're relatively small civil society organisations that support older people to live independently and participate in their communities through a range of different opportunities provided at a neighbourhood level. There are about 35 organisations operating 37 different neighbourhood networks across Leeds, pretty much one in each postcode, so they're aiming at kind of total coverage of the city. And they receive core funding from the City Council, and then also they have to go out and look for funding on top of that from foundations and other funding organisations. And the main outcomes they're trying to achieve with their activity is reducing social isolation and loneliness, increasing community contribution and involvement in local communities, improving choice and control, and enhancing health and well-being. Can I have the next slide, please, Chris? And so we spent about a year scoping out this evaluation, and we'd had a plan. We were just about to sign it off this March, and then the pandemic hit. So we realised that what we were planning to do was no longer appropriate, and we needed to pause it. But we decided we still had some resource, so we should think about how we could repurpose it to help in a time of crisis and need. And so what we decided to do along the research team, and we talked about it, was what's called a real-time evaluation to look at the Leeds Neighbourhood Network's response to the crisis, but also how they fit within the broader strategic picture of what Leeds, the city, was doing in response to the pandemic. Real-time evaluation is an approach that was developed in the context of humanitarian crisis response, and it broadly involves a flexible, rapid cycle of research with regular, accessible and actionable reports to aid response planning and decision making. And the point is to feed findings back into the system regularly during the field work rather than afterwards, to enable that more informed decision making. And there are a huge range of reasons of why we did this, but one of the main ones was around the perceived benefits of what that could achieve for the networks themselves, but also other stakeholders in Leeds. And so in the short to medium term, that's regular up-to-date information to support decision making and planning, and also to help improve the reach, quality and effectiveness of the Leeds Neighbourhood Network response. And then in the longer term, it's more about the evidence about the role and the contribution of the Leeds Neighbourhood Network we're making to the COVID-19 crisis, and also to inform future commissioning decisions about the role and the funding of the Leeds Neighbourhood Networks within the future health and social care system. I'll now pass over to Chris, who'll give you a bit more detail about some of the findings from the research.
Thanks, Luke. It's been really, I guess, refreshing to work with a funder during this project who's been prepared to kind of flex what we're doing and not kind of make a stick to a Gantt chart like we might normally have to do. And we've also got some really interesting methodological reflections on the real-time evaluation methodology that we'll have to leave for another day. So what are the key findings? The first set of findings relate to the role of the networks in the crisis response. One of the things we picked up was many of them saw this coming. They're already planning in advance of lockdown. They're ready to identify needs and respond quickly and flexibly. One of the things this involved was a rapid shift from providing what was traditionally group-based support to focusing on how they can support individuals. This has involved providing direct support to thousands of older people across Leeds, providing food, medicine and essential items, but also providing social and emotional support, phoning people up on a regular basis, checking that they're kind of okay from a welfare sense, but also making sure they have company. So kind of keeping that goal of reducing isolation at the front of their minds. They've supported their members, so the older people that they work with, both existing members, but also new members, people that were really in need of that support. But they've also, in some cases, broadened out to support the wider community, particularly when they've been asked to take on a community care hub role, which is voluntary organisations supporting wider volunteering and coordinating voluntary action at a neighbourhood level. For the networks, this has led to increased reach and increased visibility. They're getting more referrals, they've had new volunteers, but they've also had a rise in demand. When looking across the networks, we can see that the response hasn't been even. They've done different things, and that the way that they've responded has been determined by a range of enabling factors and mechanisms. So, of course, resources and capacity. The core funding has been absolutely vital, but also having the staff capacity and volunteer capacity and availability to provide the service that's needed, and also having access to facilities and equipment. So those networks had access to a building with cooking facilities, for example, were able to provide food relatively easily and relatively quickly. We found they had a pre-existing reach, knowledge and understanding of their communities. They already knew where people were, who they were, and the type of support they might need. So this enabled them to access people that might have been unknown or perhaps invisible to wider health and care services. Their embeddedness in the community gave them an understanding of specific needs of communities of place and interest, and also enabled them to link into wider service provision within the voluntary and public sector. Their presence in the community was known and it was trusted. They're also value-driven organisations. The commitment of key staff and volunteers to ensuring the needs of their community were met was absolutely really evident throughout this. Time and again, people told us they're prepared to do whatever it takes to make sure the community can go without. We think there are two broad types of network role within the Leeds citywide response. They were complementary, doing what's expected. And I was taken by Kathy's presentation yesterday when she talked about community resilience framework and the absorptive, adaptive and transformative capacity. And I think what we're seeing here is the absorptive capacity. So they're embedded in formal structures such as community hubs, coordinating voluntary activity. They're also working closely with their local partners across the sectors to make sure that the support was coordinated effectively. But they're also doing supplementary work, going above and beyond what we might think about as their adaptive capacity, providing additional support outside of formal response structures, finding new ways to support and reach vulnerable people, and engaging people who might have been under the radar of other providers. There were challenges for the networks associated with their response. We saw the intensification of the work, particularly for key individuals, as particularly problematic. The increase in demand, meeting the needs of people with the same or often less resource, meant that lots of staff and volunteers had to work longer and harder to sustain their response. And there was a sense that this wasn't going to let up anytime soon. This was particularly the case for the hubs, but not only the hubs. And the concern that really emerged here was the risk of burnout and burden for key staff. So these were the network's biggest assets in many senses, also potentially their biggest weakness. And they also talked about the risk of isolation and lack of support from their boards, many of whom were shielding due to age and ill health. We also found that being a community hub created tensions for the network. So whilst it was a key role that complemented the citywide response, it was an opportunity to broaden their reach and visibility. Some were worried it might provide a distraction away from attending to the core needs of their members and their kind of initial mission that they have. So moving forward, they're thinking, do we retain this role post-crisis and expand up their remit, or do they revert to a business as usual model? The next set of challenges are related to funding and sustainability. And although they weren't at immediate risk of funding crisis or closure, and I can't emphasize enough the importance of core funding here for kind of a key driver of their ability to respond. They were doing what they were doing within existing budgets. They were cautious not to overcommit. And there was a sense that more funding would be needed in the longer term if this role was to be sustained. They were losing income from some activity, and current ways of working were far more resource intensive than before. They also had some concerns around volunteers. Many of the new volunteers they'd had were now returning to work from furlough, and many of the older volunteers might still be shielding or experiencing deteriorating health and less able to provide face-to-face support that might be needed moving forward. So what does that mean for the networks moving forward? And in some sense, we've got the sense that they're moving now from an acute crisis response to what's being termed as recovery, but we might think of as resilience and a new normal, particularly reflecting on what Carl was saying this morning. Because what we found is that initial demand for crisis support has dropped off. And now what they're thinking about is what role can we play moving forward? Things they're thinking about themselves are how do they find new ways to provide social support? How do they go about providing group-based support? They're thinking about how they might get people out and about and moving more, including as groups. And they're thinking about how they reconnect people with their community. We wonder if there might be need to offer individual neighbourhood networks and other similar types of organisations bespoke, tailored support to help them navigate this period. And there's this wider issue around kind of like what's the citywide vision for the networks during the next phase? Where should this come from? Should it come from the top down or the bottom up? And what roles should the networks play and how will that be resolved? There's also a set of practical concerns for communities that we've picked up, and we found that what the networks are telling us is that support during the pandemic recovery phase is likely to be needed in the following areas. Unemployment, so supporting older people deal with financial hardship, support to find work if possible, their confidence, helping them rebuild their confidence to re-engage with what the networks are doing, but also to other services, and to help them reconnect with communities and social networks. Mental health was coming through really strongly. The networks seeing much more acute needs due to the effects of prolonged isolation, and more people being isolated, and the effects of that isolation being more pronounced. Physical health also emerged for this group, and there was a sense that those that were shielding and isolating had maybe become physically deconditioned, and there were concerns around their strength, balance, routing, etc. Next winter was a big concern. The networks were wanting to plan for that now, but they were wondering what support there might be to do that. And finally, digital inclusion, and this has come up time and again in these presentations. The sense that this will be vital moving forward. Some progress was being made, but there's more to be done. And some of the networks recognise themselves that their own limitations, skills and expertise around digital had perhaps been a barrier to progress. We wonder whether there might be an opportunity to build some intergenerational support here. I think what this suggests is that moving forward, there's going to be a more intensive model of support needed, and that then means more resource than is currently provided. And again, questions around who will provide this and when it will be available. And then finally, I think what we'll conclude with is some philosophical concerns for the networks themselves and for wider civil society. Many of them are now more visible than they were before the crisis. They're more visible to their local community, and they're more visible to other parts of the system, public services, the private sector. On the one hand, this has led to a better understanding of the importance of these small organisations in a crisis response. There's a deepening of system-level knowledge of and relationships with the networks. But as I've argued previously, this added visibility isn't without risks. The additional demands and expectations from public services, there's questions about whether these will be realistic and whether they'll be resourced effectively. There's questions about the limits this might place on the network's autonomy and independence, whether this could inhibit their ability to be flexible and responsive moving forward. And then there's concerns around kind of top-down scrutiny, upward accountability and expectations, and does this risk the bottom-up nature and kind of essence of networks work, which is based on a kind of an associational model. So then that leaves there a kind of a remaining question, thinking back to that, that community resilience framework that Kathy mentioned yesterday, around what's the transformative capacity of the networks in the longer term, and will this be realised? So if you're interested in finding out a little bit more about this presentation, it builds on the findings from a report we published a couple of months ago. And we're currently in the process of doing more detailed analysis of our current data, and we'll publish a more detailed analytical report, hopefully towards the end of this month or in early October. Thank you.
Thank you, Chris. And thank you to all our speakers for keeping up to time. We now have time for some discussion, and I'm going to ask my colleague Chris to look at the questions that have been posed through the Q&A function.
Thank you, Véronique, and yeah, thank you everyone for some fantastic presentations there. I was really struck at just how many cross-cutting themes there were between each of the presentations. It was really sort of tightly knit panel with lots of connections to draw between them. We've got quite a lot of questions to get through, so I'll do my best, and we'll kick off with Amanda. And particularly, this is the point on you made the point that pre-existing relationships were really important and really useful. I think the question is just if you've got any advice on how maybe you could operate when those existing relationships aren't there, and how you can potentially develop new ones in the lockdown situation.
Yeah, it's harder now. Normally, normal circumstances, it'd be lots of time, lots of couples, lots of finding connections and common values, but obviously those things are more limited now. So my sense very much is that relationships and that take time to invest in. So thinking carefully about capacity and actually the rationale for what relationships there are. Obviously within the communities that we've observed in these projects, the relationships are very much one-to-one, word of mouth very often. Relationships with artists are kind of developed and sustained, and critically that sense of trust was really important. So I think it's about being mindful of how much capacity you have to invest in that to build and sustain those relationships, to create that sense of trust that then can kind of support projects like this going forwards. Alongside kind of understanding what the purpose of those is and being really key and clear with that, especially at the moment with times being so different. So almost being selective, so you've got that capacity to invest properly in them and develop them. Others may have other views as well.
Thanks.
Does anybody want to chip in? Chris?
Yeah, I guess I'd just add, I think that's absolutely right. And one of the things we picked up is it's not that there's a lack of opportunities to engage. And I think one of the challenges, particularly for small community organisations, is how do you prioritise which are the right opportunities to take up to build those relationships? How do you know? And particularly at a time of crisis, understanding kind of how the land lies locally, how and when to prioritise your resources to engage in in things that might not yield benefits for a while is a really difficult balancing act. And I think sometimes the communication, particularly from the top down in that regard, hasn't been as good as it could be.
Does anybody else have any points to add to what Amanda and Chris were saying? Nope. Chris, we can move on to the next question if that's okay.
Great. So the next questions I'll point towards Patrick, but again, there are implications for all of the presentations if anyone wants to jump in afterwards. I see you've already answered the specific point, Patrick, in the textual part of the questions about how you manage potentially the message coming from central government or federal government and the information coming from Donald Trump and other sources, and how you deal with potentially misinformation out there. But potentially you could say a bit more on the more sort of general aspects of that question, which is the relationship between the voluntary sector and the state. I know that in the opening plenary we had discussions about the different models of relationship. So you've got sort of adversarial and more political, but then equally you've got the more cooperative angle. And so I'd just be interested in your take on that. Just don't get to,
yeah, I mean, when that question was posed, I was like, well, maybe I should have paid more attention to that. But I mean, frankly, in the early days in April, Trump wasn't talking a lot about, you know, pandemic, that it would all go away and disappear and all that sort of stuff. I mean, our governor's been more proactive in sort of addressing the pandemic. As far as misinformation, I mean, that's one of the reasons we wanted to do the resources website, was so people could find the right information in easily digestible form. I mean, our local city, we had a difficult time engaging them in a lot of the work. They were, I guess, dealing with some other crisis, as turns out. The city manager resigned in the middle of all this, and it was a bit of a hot mess. And so we were really disappointed in the city leadership on this issue. But I mean, as far as the credibility of the website, I mean, that's one of the reasons we really wanted all the logos, and that the Chamber of Commerce was involved, United Way in the city, that this is a legit website. It wasn't some crackpot website, which we have a lot of in America. And so, and that was really important. And I think local media helped a lot too. And the mayor mentioned it in the video that he did. So I thought that was really critical.
Thanks. Did anyone else want to comment maybe more broadly on the relationship between the voluntary sector and the state, and how they sort of manage that tension? No, let's go and move on to the next one. This is for Wendy, Richard and Rob, and it's a question again with a sort of broader theme about sustainability. And it's whether you have a sense of how many of the organisations and activities that were being undertaken were again ones that pre-existed COVID and the lockdown, versus how many were new, and what activities were new. And regarding any sort of new activities and organisations, how sustainable do you think they are? Potentially, I guess, how could they be made more sustainable?
That's a really good question. Should I go first?
Yeah, please.
Richard, I'll just have a go and then you can jump in. So it's 26 areas, and they're kind of quite different areas. And what we've in the design of the study, most of them are linked to this big local program, or also the Creative Civic Change program. There's a couple of areas where they're not linked to either program at all. In terms of the kind of access points to those areas for research, by and large, we were going through those existing connections, community groups and partnerships that were already there or had been set up in, because these are kind of resident-led programs, and where the programs aren't actually in place, it was more to do with kind of local groups on the ground, churches, etc., and mosques, where they're kind of active in those neighbourhoods. That then leads to the question about the kind of broad array of activities that have been taking place through these kind of communities. And by and large, there's a sense in which fairly quickly, I think, as we'd indicated, people adjusted and adapted their responses quite quickly to immediate kind of needs. So particularly around food distribution, deliveries, things like that. And then kind of moving on, as I think Amanda had said in her presentation, to things around kind of, art, creativity, activities for people to do things and to kind of keep occupied, I suppose. One sense I've had is that through our kind of work reflecting on kind of 5 to 6 months of this, is that that sense of those emergency activities, people they are still doing them to a certain extent, but people have moved on into a kind of non-emergency space now, and they're trying to kind of think through, what does that mean now? What are the longer term kind of needs of our area, as I think Chris had said in his kind of presentation, looking ahead to the kind of broader, wider and maybe deeper kind of problems and concerns that are there as well. So it opens up then questions about the kind of broader sustainability of those kinds of activities as well, and the resources that are required. And I'll talk at a more general level. Richard and Wendy, I don't know whether you want to come in with some more specifics if you can.
Okay, shall I come in, Richard?
Yeah, that's fine.
So, I mean, particularly the area that I've been kind of case studying and working with quite closely, I think there's a mixture of, most of the activities have been new. They've been a response to COVID, and it's been working in a different way, but it's all built on stuff they're already doing, and some of it's been upscaling. So they did have a food project, and actually that was about kind of addressing food waste, but it's become a much bigger project, and the kind of take up has been much bigger. So I think, and they've also increased the number of volunteers that are now working with them. So I think there's a kind of hope that some of this will be embedded into long-term change, you know, and some of this is very kind of positive for the area and for, you know, and then I think now as lockdown, you know, is, and the other thing that's been quite interesting is we were using the term and around the two phases of our research as being the response to COVID-19 and then the recovery from COVID. And actually, I think we've all kind of dropped the word recovery because it feels like no one quite knows what's going to happen. But I think that there's quite a lot of what's happened now that will be embedded in terms of how those areas go forward. And the other thing that's possibly a kind of particular thing for big local areas is because big local partnerships have a plan, and that's the plan in which they draw down their funding. It may well be that some big local partnerships adapt their plans in relation to the activity they've been doing as a response to COVID. And they're in a kind of good position to do that. You know, obviously not, you know, that's not something that's open to all communities everywhere, but that's a very positive thing around the flexibility of the programme. Richard, do you want to add anything from?
No, to be honest, I think you've covered the areas that I wanted to mention, that strong linkage there with pre-existing activities and services and looking at that sustainability. So anyone else is free to sort of jump into that, but I'll just throw in a sort of related question that we had from Jeff, I think, which is about the sort of, well, firstly, a sort of reflection across the pieces about the importance of the flexibility and the agile nature of these organisations and groups to be able to make things happen quickly. But then the sort of the question looking forwards into potentially quite resource constrained times, starting from a position where we've had local authority cuts and austerity, and that's the sort of political agenda that we're starting from, and Brexit as well, of course. So where's potentially the resources going to come from going forwards to fund some of these activities, even if the momentum and the goodwill is maintained? Is there a potential resource crisis for some of this activity?
Stephen, I think you wanted to build on the previous responses, but you can maybe link the 2 points.
Try, for sure, yeah. So on the kind of existing relationships, new relationships thing, I certainly, where our experience was, there were existing relationships, but actually they were a bit, I don't know what's a good word, but a bit thinner, perhaps a little less trusting, a little bit used to working in an environment where you talk about funding that's available. We might be competing for it sometimes or trying to collaborate with it, but it certainly wasn't necessarily as that. Whereas in this scenario, because of that unifying cause, that kind of went out the window. There was jobs for anyone who wanted to do it. And we just, we were able to kind of get the powers, if you like, to sort of open their pockets enough that we could just throw effort at it. And therefore that kind of idea of is it you or after you please, it just went out the window. There was enough for everybody to do really and get stuck into it. The key thing about legacy for that though, for me, is the changing nature of those relationships. I mentioned in my speech, we've gone from kind of aloof to kind of like, it's like we've kind of been out and got drunk together or something. Do you know what I mean? We all kind of know each other a little better now. I mean, that's a terrible example, and I'm sorry if you don't drink, but you know what I mean, yeah? As a result of that, we've gotten a shared experience, and now we're trying to build on that to say, what does a a food justice network look like for the city then? Because we were all doing it and we all wanted to make it happen, if you like, or some of us weren't, but you know, actually working together in some ways has been really positive, hasn't it? So, you know, we're kind of trying to make something happen in that kind of respect. And I suppose there's a sort of a deliberate kind of asset-based approach trying to kind of make that happen. In terms of where the money's going to come from, where the resources are going to come from, I really don't know. It's a really difficult question. I mean, one of the things we had, of course, certainly as an organisation that was funded by government through various means, furlough wasn't an option. You know, people couldn't be furloughed, so we were able to turn to funders and go, we've got staff that aren't going to be able to do what you said we're going to do. Let's get them stuck into that. But equally, there were a lot of people who were working in lots of different industries and places who, you know, suddenly were out at furlough, but were more than happy to come and do some volunteer work, you know. So that, you know, kind of hopefully what we've said, which is about 7 out of 10 people want to continue, we're going to have to find different ways to work with them. So we're already, for example, seeing that those who are volunteering, driving to deliver food and stuff can't do that in the day, but they're happy to do some of that in the night. Or in the evening, sorry, not in the night, but in the evening. So, we're changing the structure of what we do to try to meet where they're at and what they can do, you know, and give a bit more sort of power to them so that they don't just disappear. So that's a thought, I suppose.
Does anybody else want to talk about the future and future resourcing and funding and income generation? Chris?
Yeah, and I guess I'm probably making the point I made yesterday, but I'll make it again about how I'm not sure central government really recognises the extent to which prospects of the public sector in terms of the amount of money that central government gives to the local public sector are intertwined with the prospects of what local civil society can do, because and that's twofold. It's around if the local public sector isn't able to meet the needs of local people, then civil society organisations will inevitably try and step into the breach, provide a stepping plaster. Well, that then detracts them from doing maybe some of the more innovative activity. And at the same time, by not funding local government effectively, you're not giving them the means to support civil society financially themselves. So I think there's a massive political problem that needs to be overcome if we're going to be able to move forward in terms of rebuilding communities in this way. It's obviously, it goes beyond finances, because I think volunteering and things like that have also shown themselves to be vitally important, and kind of organisations having access to buildings and facilities and equipment is vital as well. But there's this real there's this issue that we need to kind of get home to central government about, kind of like you've got to trust and fund local public services to provide support to local people. Otherwise, we're just going to be we're just playing whack-a-mole if not. I
think I saw Rob's hand up.
Yeah, it's partly an echo of the point that Chris is making, which I think is really important. The very simple and facile answer to where does the money come from the magic money tree is the obvious kind of answer to that. But what we've seen, I think, and this is the point that I think Chris is alluding to, is that sense of how this is really opening up new relationships between civil society and the state. And we've seen in our big local related research on community responses, how local authorities have effectively been saying, well, you know, the crisis has shown this amazing resource and capacity that's there at community level. Can you just continue that a little bit longer? And we've got these emerging needs that we need you to help out with, because we haven't got the resources to do it. So it may not even be an ideological point that's being made. It's local authorities being in real financial difficulty themselves and seeking therefore to just invoke that capacity in order to kind of continue kind of services into the next stage, which I think is a real difficulty and a real challenge for community groups to try and respond to as well.
Yeah, can I just come? I think you're right, Rob, and I haven't spoken to a local public service official who said, I think we should give the civil society less money. They're all saying we want to be able to give civil society more money to support them to do the things that they've been doing really well, but we just haven't got that option at the moment. And I think that's where the challenge is.
Chris, were there any more questions?
Yes, there's a couple more for Rob, Richard and Wendy, which potentially I could, or they could try and sort of tie together a bit. I think we just touched upon it a bit now. So one is the relationship with the local authority and to what extent it was able to enable this activity in particular areas, relating to all the constraints that we've just been talking about, or whether the big local in those areas really was the critical factor because of the constraints from the local authority. But also sort of more widely than that, how much variation you've potentially seen between the different big local areas, and what factors might be influencing that and which areas can offer which activities.
Right, I've got a lot of things to try and tie together. I'm probably going to be able to speak a little bit more to the variation because I've been able to take a bit of an overview of the 26 areas. But Richard and Wendy, do you want to say something a bit about the relationship with local authorities in the areas that you've been studying, if that has come up in your particular case study research?
Yeah, I'm happy to. I mean, the area that I've been working in has just historically had a bit of a difficult relationship with the local authority. So I think big local areas vary. They really vary, and they all have different relationships. Some of them have local authority people that work very closely with the partnerships. Some don't. You know, there's a real kind of difference. The area that I've worked in have had quite a lot of frustration that they've had to pick up people that have, you know, they've seen falling through the gaps of statutory provision. And, you know, that's been something that's kind of caused some conflict, and it's been something that you know, that they've tried to kind of pick up in different ways. But it is just so variable, and yeah, I wouldn't like to answer across the piece for it, so to speak. Richard, do you want to add anything?
No, just very briefly to say that the area that I've been working in, it's been a three-way relationship between the parish council, so the real local government, again, pre-existing community centre, and the big local, and that people knowing each other and those trusted relationships between those organisations.
Yeah, can I just, before handing back to Rob, just to pick up on something actually Kim put a message in the chat which I thought was really helpful around big local areas, and we've also seen that trend. So we've seen a kind of trend now with some of the areas where they're moving towards issues around employability, particularly, and skills. They're starting to respond to some of the longer term issues that have arisen because of COVID. So I think in the social media analysis, the team member that was doing that kind of talked about how that had changed over time. So it kind of started off with the food response and other responses, and has moved on to information, and is now moving on to kind of building skills of community. So, and that's not exact. She would put it much more eloquently, but things have happened in stages. So I thought Kim's point in the chat was very helpful. I'll hand back to you, Rob.
Yeah, so just a quick point about the kind of the variation, and obviously when you have 26 areas as part of your study, in a way you're kind of built in to look for and experience variation in kind of responses, and we have seen that variation on three levels really. One on the kind of the range of activities that groups are trying to undertake in response to their immediate needs. One on the kind of level and proactivity of response. So there have been some big local partnerships that are kind of organising kind of committees in those areas that have been highly proactive in trying to think about what are the needs here, how do we respond, how do we adjust the kinds of things that we had been doing in order to meet those needs. But there have been some that have stepped back a little bit and said, well, let's just wait a bit and see, because there are statutory responses that are going to come in here as well, and therefore we work out where the gaps are, and then we can fill in some of those gaps. And then there are also variations in the kind of degrees of collaboration, the sense of kind of working beyond boundaries, including with those kind of local statutory bodies, not just the local authority, but others as well. There's kind of variation there. So we've experienced it, we've seen it, and we're tentatively exploring it. We're going to do a bit more work on the local authority side of this in the next stage of the research. But we've been trying to think about how do we explain these kind of variable responses across the 26. I mean, one divide that's there, and it's built partly into the study as well, the big local resources that are available to those partnerships do make a difference. There are resources to hand that can put things to activities very quickly, and that's really helped for many of those areas. It hasn't been the factor that's determined whether there has been a strong response or not. What we've been looking at there, and we're tentatively thinking about this idea of community level infrastructure more broadly, and that's kind of built up over time. Partly it's big local resources that have helped invest and build that, but it's partly about kind of rich and established community networks between groups. A sense of community leadership becomes important in here as well. And the kind of relationships that get built with statutory authorities. And it's not just with the council, it's often with key individuals working at local level within local authorities as well.
Rob, I'm going to have to interrupt you
sorry.
because unfortunately we're nearly out of time, which is incredible. I mean, we could have gone on and on, I think, but there's only 1 minute left. I really don't think we've got time for another question. I don't know if anybody has some final reflections that they want to share. I know people have been sharing reflections via chat, so that's really good. Any final reflections on a really rich set of presentations and comments? Amanda?
I just wanted to add something in around what we've really seen as a human response. And I think that's really important, that the empathy, and often the gestures have been just about trying to connect and fill space and make change, make a difference to people. And I think it's really important to remember that going forwards as well, that doesn't get lost, that sense of space for that response has been critical.
Thank you. Well, that's a great way to finish the session. Thank you ever so much to all our speakers. That was a really rich